From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Welcome to this edition of Inside the 1581. I'm Rich Rasmussen, and I'm your host, and we're delighted to have joining us Isaac Squyres with the firm of Jarrard, which is a strategic consulting and communications firm that works with hospitals all across the country and has been working with the Coalition to Protect Healthcare in Oklahoma. And Isaac, welcome to this edition of Inside the 1581.
Appreciate the opportunity to be here.
So for our listeners, what we're going to talk about today is a most recent public opinion survey that was performed for the Coalition to Protect Healthcare in Oklahoma. And the public opinion survey was performed by Jarrard, and it examined the public attitudes as it relates to the public support of Medicaid expansion and overall opposition to cuts to the Medicaid program in Oklahoma. And so Isaac helped lead that conversation with members of the coalition, but also was part of the development team in that survey. And so what we thought we'd do is invite Isaac to come share with us, what we learned. Because Isaac and I looked at it, there were some really good nuggets there in terms of public opinion, how public opinion in support of Medicaid expansion, as an example, was significantly strengthened since its passage on the ballot here in our state. And so I'm going to let you roll with that. And just kind of walk us through what you learned as well, and maybe some thoughts that you have in terms of your experience in doing this in other states, what we can learn from this also in a larger scale in our state.
You bet, and thanks again for the opportunity to be here and to share this information. We did the survey in March. It was a sample of 1,200 Oklahomans age 18 and over, representative demographically of the state's population, and had a margin of error of plus or minus 4%. So when we do this kind of work, what we are aiming to do is to get a representative sample of the state's demographic and geographic population, so that we really get a sense of how people are feeling about the issues, and we were able to achieve that. And I think there are a number of interesting findings, Rich. I could talk about data for days.
And I want you to do that before we get down that. So the survey universe was rather large.
Yes.
I think that even shows that the data is even much more sound than what we might see in some political opinion surveys that might survey 350 people.
That's absolutely correct. I think, the gold standard in terms of sample when you look at national polling is you typically aim for 1,000 or thereabouts, or maybe a little bit more. And we were able to get at a universe of 1,200. So I think really confident in the findings, which are pretty important, I think, in terms of understanding the lay of the land. And as we're talking today, this issue of Medicaid is absolutely front and center in the national discourse, and really important to Oklahoma. One of the things that we're able to do is to look at a number of factors. And I think the biggest takeaway with regard to Medicaid specifically is a majority of people do not want the Medicaid program to change.
And I think that's important. I think they like what they have today. They certainly they would like to see improvement. Everybody does.
Sure.
But I think that in of itself is is a demonstration of how the public's support has grown since it was approved on the ballot in our state.
It's a great point. I mean, you rarely see the strength of the numbers that we see around an issue like this. 78% of Oklahomans that were surveyed support keeping Medicaid as it is today.
78%. That's an amazing
78%.
number.
It really is. And frankly, half of those 78% strongly support it. So you've got basically a majority of people in the state who strongly support keeping Medicaid as it is today.
And I think that's indicative, though, when we look at the population in Medicaid expansion as one example. I mean, these are folks that experience will show the vast majority are working.
Yep.
And some of them might be working in gig jobs where they don't have benefits that are available to them, or they might be working in seasonal employment. I know that my experience in other states, particularly in the western states, we had a lot of folks that worked the summers fighting fires. They found themselves, their contracts unwinding at the end of the year or at the end of the summer, and now they were unemployed, they didn't have benefits, and they were then looking for the next opportunity. And so folks find themselves in that gap between employment and expansion, as one example, allows them to continue to have healthcare coverage.
I mean, I think that's a really important point, and one, frankly, that Oklahomans in this survey, as our survey shows, really understand that insurance coverage is a vital pathway to health, and there's really strong support for insurance access. 90% of those we surveyed said that people who live in Oklahoma should be able to get adequate health insurance regardless of socioeconomic status. So think about that. 9 out of 10 people understand the importance and the value to the community of people being able to have access to health insurance. And as you know, people find themselves in a coverage gap, right? And in a situation where they can't get insurance for whatever reason, they end up needing the insurance coverage through Medicaid. And Oklahomans understand that that's important. 90% people view that you should have access to insurance coverage regardless of socioeconomic status. Really important, I think.
Well, and I think there are people who are certainly on the program are going to support it because they are. But then there are employers and there are entrepreneurs and others who understand the importance of their team members having access to healthcare. And if you're a young entrepreneur, and let's say you're starting a business and you've got 1 or 2 employees, you're just getting going. And we want to be able to support that entrepreneur, but they may not be at a place in which they can provide health insurance to their employees.
Mm-hmm.
And so they have, temporary employees, or they have employees at the lower end of the income until they can get their business up and running. So essentially, what we've seen as Medicaid expansion is one example. It is probably one of the largest business subsidies that a state can make available to business owners. And I don't think we think about it in those terms, but in my experience, it is just that, because many of these people are already working, and we're supporting young business upstarts that want to be able to grow a business. And this is the one place where they just can't quite afford it to support, even if it's a modest support of the premium for their employees until they get a little bit bigger. And so we're seeding that. And I think that's an important part that we oftentimes overlook.
I think that's a really good point, and I think it ties to one of the things that we found in the survey, and that is that economic issues are the top issue in the state, followed closely, by healthcare. So you think about the impact of the Medicaid expansion, for instance, on the economy in the state. And you tie that to the fact that people are concerned about inflation and the cost of living and the overall economy and jobs. So anything that policymakers do that can potentially impact negatively that economic environment, that's going to rise in importance to voters. So, I mean, I think we think about, Medicaid and Medicaid expansion as a healthcare issue. It's also very much an economic issue. And when you combine those things, those are the things that are all top of mind to the public, according to what we found in the survey.
I think it's a really, really good point. And I'll let you run through the rest of these numbers, but I think for our listeners to understand when this poll was done, it had not taken place. Well, let me back up. It took place before a lot of the chatter and a lot of the concern over potential cuts on the federal level. So before we got to this crescendo effect in April and now the beginning of May of potential $880 billion of cuts in Medicaid, we weren't even talking about that at that point yet. So it would be interesting to note what the potential response could be today as people feel more concerned about losing their healthcare coverage.
Yeah, I mean, I think that that's important. We just did a national survey, actually, again, not specific to Oklahoma, but it was, after the crescendo, as you referred to it, around economic issues. Economic issues nationally are at 48% as the top issue. So when we're thinking about the economy and the impact of healthcare on the economy, a really big component of things. I mean, I'm struck by the news out of Washington, that potentially, up to 12%, I think it's 8.6 million people nationally would lose healthcare coverage under what the Republican Congress has put forward as its plan. That's about 12% of people. I mean, if you do that math, that's hundreds of thousands, of people in Oklahoma who would lose health insurance coverage, which I think, what we found is even without, those specific numbers, overwhelming support for keeping the program as it is today. When you start to actually put numbers to things, it makes it real for people. And I think it makes it real for the impact that it would have on their friends and neighbors and family members.
That's excellent, because when you stop to think about this, it is lives that are impacted by those who lose coverage, but also the provider community that provides that care. As we continue to ratchet down on coverage, it means more people will show up uninsured. And if they are uninsured, it does create strain on the system, particularly in our very rural communities. I mean, we look at the benefit that expansion has had in our rural communities, where it is essentially new coverage, right? Because it came after the Affordable Care Act. Always in our inner cities, there was always some level of significant representation of those that met the aged, blind, disabled populations. But when we moved to the expansion population, that's where we picked up large swaths of folks who are uninsured, and now they have coverage for the first time, and they tend to be in these rural communities. And so these cuts will have the potential of, reorganizing the way in which care is delivered and available in small counties all across this country.
Exactly. I mean, there is a significant impact, broadly, but when you home in on specific geographic populations, specific demographic considerations, I think you really see people understanding that a reason to not be, or I guess I'll put it, a reason that the cuts are bad is because hospitals in rural areas may not have enough money and are forced to close, or service cutbacks, things like that. Those reasons that these cuts are not necessarily good specifically impact the way people perceive the issue. So I think the more people tune in and are aware of the impact, I think it's just something to be really mindful of, that we need to understand kind of where the public is and what matters to them. They want to keep Medicaid as it is today. They care about their rural hospitals. They care about people having access to health insurance coverage regardless of socioeconomic status. All of these things are drivers for the reasons why people don't want Medicaid cuts to happen.
Great point. Let's continue to go through some of the slides and some of your observations.
You bet. I mean, I think one of the things that's important to understand, and I just want to go back to that 78% number real quick. That 78% number cuts across all self-identified political party affiliation. 70% of Republicans support keeping Medicaid as it is today. 80% of independents. And Democrats as well at 90%. So regardless of whether a person may identify as a Republican or an independent or a Democrat, strong majorities of all of those political affiliations are support keeping Medicaid as it is today. And I think that's really important. It's a bipartisan issue, or it should be, the fact to be able to keep Medicaid as it is today. One thing that I think is important is a majority of people in Oklahoma say that healthcare in the state is meeting their needs, which is, important. 55% say that healthcare is meeting their needs, which is, as you said, there's always room for improvement, but, definitely a good signal. I think another thing that's important is that when you look at the healthcare in, writ large, more than half of people do not want major reform to healthcare. People are generally pretty happy with the state of healthcare in the state. So there's not a big appetite for change. People are feeling like their needs are being met. The majority do not want major reform. And again, going back to that 78% number, when it comes specifically to Medicaid, people do not want that program to be different than it is today.
When you think about that, Isaac, it's there are very few things that are very personal, right? Where the government is really in an intimate relationship with you, and I think one of those might be in healthcare, where for many folks, and in Oklahoma as an example, let's just use pregnant moms, where I believe it's 56% of all deliveries are paid for by Medicaid, and so the government is very much involved in ensuring that you have these services, and I think when folks are stepping back and they're unsure where we're going to go with tariffs, they're unsure where the DOGE cuts are going to go, they're unsure about world affairs, they're unsure about their children's education, they're unsure about a lot of things, but the one piece that they really are guarded over is their health. And so it does not surprise me that folks are genuinely concerned about what can happen and don't want change, because that is such an important part of their own family's sustainability, and that for their parents and their grandparents, don't change this because it's working for me. All the rest of these things that are outside pressures, those are taxing all of us, but don't change the one thing that seems to be working well for me and for my family. I have access. I live in Boise City, and I have access to healthcare there. Or I live in McCurtain County. I have access to healthcare there. The rest of the world's events may not impact me, but don't let impact the one thing that I have a relationship with, and that's with my caregivers and my local hospital. Don't change that. I think when I saw the polling results, that's what kind of spoke to me, when people were that strong and supportive. Don't make changes.
Yeah, I think that's right. And I think, underscoring what you just described is the extraordinarily high levels of trust that people have in nurses and doctors when it comes to
That was a strong number
policy
in the poll.
issues. Incredibly strong. 85% of people trust nurses as when it comes to developing healthcare policies and laws and solutions. And just doing a little quick math here, 71% of people trust doctors. So, those are the two highest levels of trust. And I think that underscores what you described, which is, that caregivers have relationships with people, and people trust those folks, white coats and people in scrubs, when it comes to developing policy solutions. People also have a high level of trust for hospitals on that same issue, and frankly, higher levels of trust with regarding the development of policy and laws than even policymakers. And so I think the voices of doctors and nurses are really important. and their perspective in this is an important consideration to take into account.
Well, good numbers for everybody. We just need to make sure that we make good on the public's expectation is, and that is, don't do anything to buy healthcare.
No, absolutely. I mean, then it extends, not just to Medicaid expansion, et cetera. I mean, we also looked at the issue of the subsidies and the ability to support payment through the ACA that is currently in law. And again, extraordinarily strong support for the continuation of that aspect of the program.
Let's pause there. So for our listeners, if you're not familiar, as part of the Affordable Care Act, we do have premium subsidies. So if somebody's making essentially less than, $19,000 a year, or they have intermittent employment, they would have the ability to qualify for Medicaid expansion. We also have folks that might make more than that, and then we have folks that do make more than that, quite frankly. They have the ability to receive healthcare coverage through the healthcare exchange, for which there is a tax credit, which helps buy down the cost of that healthcare coverage. That too is under consideration for reduction or elimination by Congress. And we'll wait to see what happens this week and the next on where that all shakes out. But we have about 300,000 people that are under coverage for the premium subsidies, and around 300,000 or so that are under coverage for Medicaid expansion. So both of those programs are potentially at risk, and more than 500,000 people in the state of Oklahoma benefit from that.
Yeah, and I think it just underscores the point that people really do understand the value of having access to health insurance coverage. They understand that it's important for their family. They understand that it's important for the economy. They feel that it's something that should be, again, regardless of socioeconomic status, available to people to be able to access health insurance coverage. And again, that cuts across party lines in terms of voter affiliation. 77% of Republicans, for instance, support maintaining those ACA subsidies. So again, this is not a political issue, although it's being played out as one right now. It's not a political issue in terms of how people feel, right? I mean, it really is a health issue. And people across political affiliations feel strongly about keeping Medicaid as it is today, the value of having access to health insurance, and people just really understand how important that is. And I think that's something to take note of.
Well, let's go through some other slides in there. I do remember looking at some of them where we actually asked the question of, if a cut was made for a following purpose, would that change your support based on if it advanced the president's policies, or it might lead to a redistribution of tax dollars? We had asked us several different questions, and I thought those results were interesting. So let's go through the rest of the slides that you have, and we'll see where they're at.
So we tested a number of messages of things that may come to pass if there are the cuts, and there were many things that would come to pass because of the cuts made people likely to oppose them. People having to pay more for nursing home care, people losing access to affordable health care, the loss of healthcare jobs as a result of the potential cuts, losing access to affordable health care, again, that hospital in rural areas. All of those things, a majority of people said that it would make them more likely to oppose the Medicaid cuts. And I think that, that just shows the number of ways that the impact may have on people is important. We also tested some of the things that folks are saying that would be used, how the money could be used. Government waste and spending is something that some people are purporting, et cetera. Those messages were not as strong. It did not make people necessarily overwhelmingly more likely to support the Medicaid cuts. In fact, they were pretty neutral. So, I mean, I think that the kind of takeaway from the slides and from the data is that the impact of the cuts, the more people become aware of those potential impacts, the more likely they are to oppose them. So, I mean, I think that, one of the things that's important is for people to be understanding the impact of these potential changes, so that we're in a situation that there's just knowledge, right? And I think that that's what the coalition is really about, is wanting people to understand the situation.
Well, I think you teased out one of those items in there, and we think about these cuts having a direct impact on access. Absolutely, they do. We think about it having an impact on rural health. Absolutely. The sustainability of rural hospitals. Absolutely. But when you start to peel every piece of that back, it does come back to the caregivers and the other team members that support these organizations. So you put a lot of folks at risk. So in a small county where the largest private employer might be the hospital,
Yep.
and you put that small hospital at risk, even for 10, 12, 20 employees, if you had to make reductions in staffing to match the reduced reimbursements, um, those are real lives. When you look at larger organizations, it's not, a half a dozen, it's hundreds or thousands. And I know we've kind of teased out numbers that if we lost, as one example, just a kind of a gross benchmark, but if we lost Medicaid expansion and what it means for hospitals, I'm not taking into consideration the reimbursement for physicians or pharmaceuticals or durable medical equipment or anything like that, but just on the hospital piece, it's as much as potentially $2.5 to $2.8 billion every year over 10 years. So over the lifetime of this, if you just took that $2.5 billion, $2.8 billion impact, we're talking about the potential of 38,000 employees impacted. So if a hospitals had to adjust their spending to match the reduction in the reimbursement, there are a few places you can go. You cut services. Nobody wants to do that. You look at how you can become more efficient. There's not a way to become more efficient to achieve $2.8 billion in savings. So it oftentimes, unfortunately, it does come to changing staffing. So, there are a lot of folks that are at risk that we don't want to be placed at risk. And in a state like Oklahoma, where it is hard to recruit people in, we do a very good job of recruiting. When the environment changes and people don't see opportunities, they leave. And that really has the opportunity to unravel the success of our state and unravel our ability to continue to grow our economy, particularly in those small towns, which will lose talent. Very difficult to get it back.
Yeah, I think the one thing about these big numbers, right? That are really hard to kind of grasp your head around when you're talking $1 billion or things like that, right? The reality is that those numbers translate to real impact on the ground in the caregiving environment, in terms of people being able to access care, in terms of people being able to get the care that they need. And so those numbers, I think it's important for people to remember, are not that it isn't about the numbers. The numbers themselves draw down to real impact on the ground that impact people's lives, from care to loss of jobs to the economy, across a host of factors, right? And I think it's easy to say, oh, well, that's a big number. Yes, it's a big number, and that big number has a real big impact.
Oh, absolutely. When you look at the potential impact of some of these cuts could have on the hospital community, it's like a base realignment commission on steroids, right? I mean, no state wants to lose one of their military bases,
Right.
but the impact on our state, with cuts that could be as big as what we just talked about, would be like closing all of our military bases. Nobody would ever support that. And the same notion, we're hopeful that folks won't support any of these cuts, and certainly can message to our elected leaders that we don't support the cuts, which is reflective certainly in our polling data.
Yeah, I mean, I think It's a really good point. Again, making sure that people understand kind of the reality of the situation and what's at stake for their communities, their hospitals, the hospitals in the parts of the state where they, may have grown up, but moved to a bigger city, things like that. I think just really, really important for people to understand that we're talking about impacting people's lives and impacting people's livelihoods and impacting ultimately kind of the overall health of Oklahoma. And that's really, really important.
Well, what else did you find in the survey, Isaac, before we kind of wrap this up?
I think one of the things, and I know we've kind of touched on it at various points, is the the feelings that people have and their point of view on things is not necessarily driven by how they may, vote in the ballot box, right? Republicans oppose the Medicaid cuts. They want to keep Medicaid as it is today. The messaging and the impacts that we talked about, everybody, regardless of political affiliation, sort of sees those things as negatives and as reasons to not support any kind of change to the program. So, that's kind of the big picture takeaway from my perspective is when you look at kind of the data in aggregate, right? You have the people of Oklahoma want Medicaid to stay as it is today. They want and understand people that have access to health insurance coverage regardless of socioeconomic status. And when you talk about some of the specific potential impacts, they even key in on specific issues that are really important to be able to understand. So, I mean, I think what you have is a population in the state that cares about their friends and neighbors and cares about the importance of having access to health care, of having access to health insurance coverage, and is their needs are being met. A majority of people, and they're not really hungry for big change, and I think that's really important to remember when we're talking about big change is, folks don't really want it.
Well, I think that's a great takeaway for all of this. And so for our listeners, we've been talking to Isaac Squyres with Jarrard. They are a strategic consulting and communications firm, and Isaac is one of the firm's leaders on their issues and advocacy services. And he's been sharing with us the results of a statewide voter opinion poll on the public sentiments towards the potential impact on the reductions in support of Medicaid at the federal level. And this week, the House Energy and Commerce Committee, as well as other relevant committees, are meeting to discuss potential cuts to the programs. And so some of you might be asking yourselves, well, how do I speak out on this? So I want to share with you. I just made sure I got the URL correct. There's the Coalition to Protect Healthcare in Oklahoma has been organized to provide an opportunity for individuals, advocacy organizations, business leaders, and others who are genuinely concerned about what these impacts could have or these cuts could have on access to health care, on the provider community, on the overall health status of the state of Oklahoma, where we perform very poorly. But we are at a place in this state where Medicaid and Medicaid expansion and the innovation of bringing the management of managed care organizations to our state to help us focus on a real strategy for improvement, all of those are potentially at risk. And so a coalition was stood up, Coalition to Protect Healthcare in Oklahoma, and you can visit the website. I encourage you to do that. It's protecthealthcarein.ok.org. And so you visit that website, it'll give you information about the coalition, what they're doing, opportunities to engage. And if you scroll to the bottom of the page, and certainly you can do it on your iPhone, your iPad, you scroll to the bottom, it says join the effort. So we would encourage folks that are listening that want to be involved, visit the website, join the effort. It'll put you in queue to receive information. And then when there are opportunities to reach out and speak out in opposition to these cuts and other policy proposals, you'll have the opportunity to do that. So we would encourage you to participate and be part of the larger community that is gathering and is starting to share their voices of concern over potential cuts to the Medicaid program. Isaac, thank you for joining us. Anything else you want to share before we close off on this edition of Inside the 1581?
No, just appreciate the opportunity. And I think, the ability to explore and dig into these issues with a representative sample of the population there in Oklahoma, I think just really paints a clear picture. Not desiring change, wanting to keep Medicaid as it is today, and understanding the importance of health insurance access, regardless of socioeconomic status. So I think we've got an interesting time ahead. And certainly appreciate the opportunity to be here with you today, Rich.
I appreciate it. Thank you, Isaac. Isaac Squyres with Jarrard, sharing with us the results of a recent public opinion survey on the public's attitudes as it relates to potential cuts or changes to Medicaid. So you've been listening to this edition of Inside the 1581. I hope you've enjoyed our episode where we've been talking about Medicaid, and the most recent public opinion survey that was supported by the Coalition to Protect Healthcare in Oklahoma. But before we go, I want to extend a huge thank you to our incredible partners at PYA and our producer, Alex Taylor, for making this podcast happen. Alex puts this together every 2 weeks. This will probably, drop this week? I would assume. He's shaking his head. Yes, so we'll drop it this week. We thank Alex for the work that he does, and to our Vice President of Strategic Communications, Susie Wallace, who helps coordinate all that we do here at the Oklahoma Hospital Association and helping to put in place our episode every 2 weeks of Inside the 1581. Please make sure that you subscribe and follow and stay up to date on future episodes. I also want to mention, as we do every week, the music that we're using, the track Gunslinger by Ends of the Earth. We appreciate the ability to use their music, and I think it has kind of a hipness. Do you think so, Alex, to Oklahoma? And we appreciate them allowing us to use their music. So until we meet again here in 2 more weeks, thank you for joining us to this edition of Inside the 1581.